Hello everyone, this is Dr. Peter Lee from Way Plastic Surgery again. And today what we're going to be doing is that we're going to go through kind of the plan and of how we did some injections to rejuvenate a face that some people have some areas of concern. So this first patient here is a 26-year-old female who specifically is kind of like talking about, I just want to look overall more fresher and more prettier. Okay? And what are some of the ways in which we can accentuate that using non-surgical filler treatments? And so for this patient, if I kind of take a look at her, the area that kind of looks a little bit kind of ill-defined is the balance between the top portion of the face and the lower portion of the face. The top portion of the face seems a little bit more narrower, lacking more volume, whereas the lower part of the face looks a little bit more heavier. So one of the first places that we did do the filler is on the temple region, like these areas. And we also accentuated the eyebrow a little bit. And what that does is that it's kind of like slightly gives the lateral end of the eyebrow to kind of go up, as well as accentuate the eyebrow so that there is a little better connection between the eyebrow and the nose. The other area that we decided to enhance is along the submalar region here, because it was a little bit hollow. And again, just because her lower portion of the face looks a little wide, you kind of want to accentuate the top portion so that what we normally like is an inverted egg look, and that's what we wanted to kind of accentuate. And then we also did a little bit of filler along the mid-face region to fill out the hollowness that she has, not on the side, but more towards the forward area of the mid-face region. Then we also enhanced her nose. What she had was she had a hump and a tip that looked a little bit droopy. And so what we do in that case is we do a little bit of filler on the, what we call the radix, the top portion of the nose, as well as an area just below the hump. And then we also did a filler at the tip to kind of lift up the tip region, because for people with a hump, their tip looks a little droopy. And so if we kind of like fill in the tip region, then it gives the tip area a little bit of a cephalic rotation. We also decided to do a little bit of filler at the chin and a little bit on the lip as well, especially the corners, to kind of give the corners a little bit of a lift. So overall, I mean, what the pyramid rejuvenation does is that it makes you look a little bit more fresher. It also enhances certain areas where you lacked that accentuation. And overall, it just gives a patient more of that rejuvenated look. So this next patient is a 30-year-old female who just feels like overall she's kind of looks a little tired. And wanted just overall like more of an accentuated look, to her face. And so if you kind of take a look at her, and the way that we normally assess a face is, number one, we look for balance, we look for facial shape, and then we go from top to bottom. So if I look at her top 1/3 of her face, the proportion's actually pretty good, but her forehead and her temple area looks a little bit flat. So it's not a smooth contour, but it looks a little bit irregular. So one of the first things that we did was we did fill out this area, which is the forehead and the temple region, with some fillers. And for specific areas, we use different types of fillers, but most of these fillers are hyaluronic acid fillers. And then the other thing that we did was we filled in a little bit of the eyebrow to kind of give her a little bit of a lift, as well as a little bit of an accentuation. And then her nose overall was okay, slightly low, but she was actually okay with the height of her nose, but the tip did look a little bit droopy, and the tip lacked a little bit of projection. So we injected a little bit of filler at the tip, and then you can see that she also has a little bit of eye bags under her eyes, which also highlights the emptiness of what we call the frontal mid-face region. So for people with kind of an exaggerated, what we call maxillary bone, which is the upper lip region, if that area is a little bit projecting, then a lot of times that transition point between the cheek region and the maxillary region, there's a bigger sort of that contour concavity. And so when we inject fillers to kind of like make that area more smoother, we don't really inject it like as if we're treating an aging smile line. What we do is that we inject it right on top of the bone so that the transition point between the cheek region and the maxillary bone is smoother. We also did a little bit of filler on her chin region to kind of highlight her looks like that. And so you can tell like afterwards, she just looks so overall a little bit more brighter, more rejuvenated. Her eyes look a little bit bigger, and there is a little bit more of that accentuation on her jawline definition because the cheek has been filled out a little bit more. Her nasolabial fold looks a little bit more smoother. So this next patient is a 34-year-old female who feels like overall like she doesn't look as fresh, and she just wanted to look overall fresher, as well as, you know, kind of like highlight some parts of the face that she felt was underrepresented, especially the central region. So if we kind of take a look at her, in terms of large surface area that lacks some volume, she certainly lacks volume in her temple region, as well as the submalar region. And for patients who have large deficit of volume, especially in these regions, we do like to use not hyaluronic acid fillers, but more of what we call Sculptra, which is a collagen stimulant. And so the way that these works is that the product itself disappears after 6 months, but it has a long-term longevity because the way that it fills is not because of the product itself, but because of the stimulation of collagen. So in these regions, we decided to go with Sculptra, and then we wanted to highlight her eyes. And so in this area, we injected hyaluronic acid fillers, a little bit more firmer type. And then we did a little bit on her nose. And then whenever we do a little bit of the bridge, we do a little bit at the tip as well. And then we also filled out her smile line. And then another sort of major area for her that lacks volume really is her chin region. We also did a little bit on her mid-face region because of the bags that she has. And these are all done with hyaluronic acid fillers. And you can see like overall her contour looks pretty good. Sometimes we think like with fillers, like the face actually looks bigger, but it actually isn't. She looks obviously even slimmer. But what really makes a huge difference for her is that because she lacked central definition, by highlighting that central area, I mean, she obviously looked, a lot more, fresher.